Hello, class. Here's the second part of the axial skeleton. And just looking here. Oh, there you go. Oh. Show you a couple skulls. Look at that. It's a little crab-eating macaque, a little monkey. You can see very human-like. And chimpanzees have the same number and type of teeth, exact number, so it's pretty amazing. And then here's a wolf from Alaska. So you can, here I wanted to show you this this crest. So yeah, very impressive. It's a male. You can have that chewing muscle come down. And just looking at this, how wide, this is the zygomatic arch right here. So lots of thick chewing muscle, very, very, when you look at this, you see it's has a very, very strong bite, right? Yeah. All right, now I'll talk about a little bit about your little baby, little fetal skull with its soft spots, and then we'll talk about the vertebrae. So a quicker lecture than the skull. All right, very cool. You can look at these x-rays. I could quiz you like crazy, you know, like what's, hold on. He's right, get my drawing tool, here we go. What suture is this? Coronal suture, indeed. What bone is this? Occipital bone. What bone is holding these upper teeth? Maxilla bone, right? All right. And now we're going to move down. We'll talk about the baby soft spots, etc. But we'll look at there'll be 7 cervical or neck vertebrae. So we'll talk about these and move our way down. All right, so babies have these soft spots, and we call them fontanelles. It means a little fountain. I think it's French, looking at a little spring, a little depression. But these are depressions in a baby's head. And they allow, what they do is that when you're born, even before you're born, I mean, the skull bones are not fused. They don't have the sutures as they do in an adult. So these soft spots, and it's a good idea because the hardest part about birth is getting that head, that giant head of this fetus out into the world, and it's got to get through mom's birth canal, especially when we look at the pelvis. There's just so much room. We can expand it a little bit because the cartilage will loosen during childbirth, but oh man, you got this big head. We have huge-headed babies, and so having fontanelles allows the head to actually have a squish and come back again. So you can see when babies are first born, they got sometimes these cone head weird shapes and things kind of rearrange. And also, our brain is going to grow very rapidly. Our heads grow very rapidly early in development. So it allows things to move. If you have a suture, you'd have to be hard to keep growing. So these fontanelles have a couple functions like that. You have several of them. This last one here, baby soft spot here, doesn't fuse until like 2 years old or so. So yeah, so if you have a baby, you can feel, I've never done it, freaky, but they're gonna have a soft spot there. This makes me nervous. They're also used, if a baby is dehydrated, it'll be sunken, or if they have a lot of intracranial pressure, it'll be bulging out. And so these fontanelles are useful looking at babies, what's going on inside that head. Yep, so you have several of them. I won't have you memorize the different names of them, but between the bones, you can see the bones, skull bones are like islands with soft spots in between them. And then as you get older, they fuse. Oh, beautiful. So just a review of these bones. This is it's called a bouching. It's a French word. Again, I took Spanish in college. But it's a way to show a skull by exploding it to show each of the parts. And very difficult to do this, you know. I'm impressed, right? Do you guys recognize these bones? Yeah, the big cranial bones, frontal, parietal, occipital, right? And then temporal bone. Remember what that bump is? Mastoid process, right? Yeah. Cool. Zygomatic bone here is your cheeks, right? And then inside, here's your sphenoid and ethmoid. They're kind of in there. They're a little hard to see looking at the outside of the skull. Yeah. And then your mandible, your lower jaw is one bone, and your maxilla is a big bone that holds your upper teeth. And then you've got little lacrimal and nasal bones, and you got some other miscellaneous. All right, let's talk vertebral column. All right, your spine, if you will. And it's made up of these vertebrae, which are irregularly shaped bones, and there's a string of them. And they're connected by these intervertebral discs made out of fibrocartilage with kind of a gooey center. So it's, instead of just being a solid bone, it wouldn't allow you to have any rotation or bending, right? So you have a string of bones. So it allows our back to be able to bend forward and backwards, do some rotation, sideward flexing. So it gives us that mobility in our back, at the same time protecting our spinal cord, which runs through what's called the vertebral canal, right down the middle, right? And all the processes, you can feel these bumps in your back, they're from muscle and ligament attachments. So, yeah. And our spine has curvatures. Yeah. Cool. Yeah, let's just go right out of here. Let's take a look. So these are vertebral discs. They're gonna make up about a quarter of the height of the vertebrae. You can see between each one, they provide this cushioning. Yeah, so memorizing these, I guess, let's see, as an infant, you have like 34 or so, but then the sacrum and coccyx will fuse. And so adults, there's usually about 26 individual ones. And you can remember this breakfast, lunch, and dinner if you need to. Cervical is 7. If you eat at 7 in the morning, let's eat breakfast. There's 12 thoracic. There's also 12 pairs of ribs. So you eat lunch at noon, and then dinner, I guess you're eating dinner at 5, maybe you're elderly or something. I don't know, it's a little early, but indeed. So you can think of it that way. But we have 7 cervical, neck, 12 thoracic, there's a rib on each one, and then 5 lumbar, or your lower back vertebrae. Generally, people can have 6 lumbar, they can have 8 cervical, and so things can vary. I've seen it, but this is the most common configuration. Your sacrum is a solid bone at my age. Many of you out there they're actually separate, 5 separate vertebrae that fuse together. And your coccyx is your little tailbone. It's usually about 4 vertebrae that fuse together in your 20s and 30s. Yeah. So yeah, the dates are amazing. You can see that. This sacrum, and you guys, if you did an x-ray, you'd see a little bit of cartilage separating each of these 5 bones. And then as you get as old as me, it's just a single bone. It's just a fused bone. And I talked about earlier how in general cartilage turns into bone in bodies, so become less flexible. It's true. All right, these curvatures. And one other thing, lower back pain is so prominent. I think of the statistics. I think 80% of adults will have to seek healthcare for lower back problems. I mean, it's just so common. And we walk upright, and that causes knee problems and back problems, evolutionarily speaking. When we walked like your dog or your cat, you didn't have those lower back problems. You were supported by these 2 pillars here. But we walk upright, and in fact, our weight is carried in the front, really, if you look at our weight generally. It's a lot of weight in the front, but in general, the spine is in the back, and so you can see that it's going to provide a lot of torque there, a lot of issues. If you want it perfect, you would have the spine right down the middle with the weight even on either side, but we didn't design it that way. We came from this way, we walked upright, and then we take our back with us. So lower back problem, huge problem in me and most humans, because we have this back vertebrae in the back, and our weight usually is mostly in the front, and so there's always going to be that tension there, and our knees are all the problem too. All right, but these curvatures that we have, the neck is called cervical curvature, so you're going to have a cervical curvature, thoracic curvature, lumbar curvature, sacral curvature, and their importance to your normal function is to have these curvatures correct. I drew all over this, sorry about that. But if you have a curvature to the side, y'all know what that's called, especially young women, and when you're adolescent, they'll in gym or something like that, they'll have you stand away and bend over and see if you have a curvature. It's more likely in young women called scoliosis. And it can be minor. If it's major, it can compress one lung. It can cause, one hips to have problems and cause a lot of problems. I've seen people with metal bars, everything like that in there. So, and I looked it up. People say, well, what causes scoliosis? And when it says idiopathic, it means we don't know. So you're just developed that way. Other ones can be linked to other musculoskeletal problems, but scoliosis is something that occurs, and they have remedies for it. And then you can be a hunchback too. It's called kyphosis. And you see a lot in the elderly. We'll see old people get shorter. Why is grandma shorter? Grandma's shorter. What happens is the vertebrae, you're going to see they're made of spongy bone. They will compress and the discs will compress. And so you get shorter as you get older. And you have collapsing of these vertebrae, causes this kind of hunchback. It makes breathing difficult, etc. The book even talks about young athletes too can get this kyphosis, and if not corrected, they'll have a lifelong problem too. I don't know much about that. And then the other thing is lordosis. We have sway back. Sometimes if you carry a lot of weight or during pregnancy, you'll get some lordosis going on. But these are all abnormal. You should have normal curvatures of your back. If you've got hunchback, your kyphosis, sway back, lordosis, scoliosis, your curvature to the side. All right, these curvatures, we look at it, we talk about this, the thoracic and the sacral being primary curvatures. So you look at the fetal position, there's just one curvature. We actually gain this cervical curvature and this lumbar curvature going the opposite direction as we grow. As we hold our head up, we get the cervical, and as we stand up, we get that lumbar. So primarily we look like this, and then we get these two are going to occur later in life, secondary curvatures. But you can see this, the thoracic and sacral are primary. You're born with that. And then cervical and the lumbar develop later. All right, typical vertebrae. You're going to see all the vertebrae have some things in common. They're going to have a body. That's the solid body in the anterior part. And then you have little pedestals. We call them pedicles. They come up. And then the roofs, maybe call them lamina. We call these lamina, the top. And this is going to make this vertebral canal. And that's where your spinal cord is going to run up and down your body. What do you think? Got a body, pedicles, lamina on top. You do a laminectomy if you remove the top to do surgery in there. And then looking at it, you often have a spinous process coming off the top. You can feel that down the middle of your back. The spinous process comes down. And then transverse processes will go to the sides like that. Yeah. Cool. And on the body of it, you're going to have an intervertebral disc between each vertebrae, of course. Yeah. And then the vertebrae are stacked up, right? One on top of each other, and then they're connected. So the one above is going to connect to the one below, and we call them facets, like on a diamond or a gemstone. The facets are those little smooth areas that really reflect the light. So these are smooth areas on the bone. You're going to have a superior articulating process and an inferior articulating process from the vertebrae above are going to come together to kind of connect those. And of course, the bodies are stacked on each other. But you have these other articulating processes that will help stabilize that vertebrae. And they allow movement too. All right. All right, let's talk cervical. So when you look at the vertebrae overall, they go from smallest to biggest because you hold more and more weight as you go from your neck, your thorax down to your lumbar region. So your biggest, chunkiest vertebrae are down at the bottom, and the vertebrae up in your neck are the smallest. It's dense bone, but they're smallest. And you have 7, so we call them C1 through C7. And one thing about them, all the cervical vertebrae have these holes. Here, these holes. They're called transverse foramen. Foramen is a hole. And through it's going to run this vertebral artery that we'll talk about next semester. But these arteries come up, they're going to go into your brain through these vertebrae. So you pick up a vertebrae in the table, it has these holes, you're like cervical, bam. The spinous process is usually bifid. It's kind of split in two. We don't have much of a problem because we hold our head upright, but think about a big moose or a bison with this 100-pound head and bison maybe. And then you're going to have you know, here's the head, and then here's the vertebrae coming, and then you have the, yeah. So they're going to have really tough ligaments back here, and we have nuchal ligament. We have it not so tough, but it's just for more surface area. If you split the spinous process, it gives it more space for this tough ligament up here. That's what it's for, in case you're wondering. All right, the first two cervical vertebrae, C1 and C2, you need to know their names. We named them too because they're really freaking cool. The first one is Atlas. And Atlas, remember, was the guy that held up the earth? So Atlas is holding up your skull. And second is the axis. And the axis is going to have a little tooth that comes up. And the atlas is going to rotate around it, like the axis. This is the axis. It's going to rotate around. And these two vertebrae are how we say yes. It's going to be between the atlas and our skull. And no is going to be between the atlas and the axis. They're going to rotate. I'll show you a picture. So these first two, very unusual. The atlas is the only vertebrae without a body. Sounds like a test question, right? Yeah, it's almost just a circle of bone. So it's just a circle. So it's very weird. And if you want to know, get a little bit of detail, what happens to the body? Well, during development, the body of the atlas went down and fused onto C2, the axis, and becomes this dens, this little, it means tooth. Do you wonder why a dandelion, it's called a dandelion? It means dent de leon, or tooth of the lion. And if you look at the leaves, they're kind of like toothy. Anyway, so dents, dentist, it means like, it's like a little tooth that comes up like that. And then this is going to rotate around it. I'll show you a picture of that. All right. Yeah, so here it is. So cool. Well, you'll be able to play with these in lab. We have an atlas and an axis. So C1 is the atlas, C2 is the axis. C3 doesn't have a name, C3. C4, C5, C6, C7. But these two, if you can see this, and again, you got to play with it, but just imagine when you say yes, it is your occipital condyles on your skull are going to be connected here, and it's just going to tilt. Muscles are going to tilt it. It's totally different when you say no. When you say no, the atlas is stuck onto your skull, and then the movements between the atlas and the axis, that's where it rotates. Look at that. Can you see it here? I don't know if you get it. I hope you get it, because you get it. It's like, oh, that's really cool. So you've split up those two actions between two different joints here. And you see the dens coming up like that little tooth. That can break in an injury sometimes. When they do an x-ray, if they want to see this, I actually go through the mouth because it's up higher than you think. It's up here, so you'll see the little dens right there. Yeah. And we call these are facets, you know, these things. And then the dens, it's held in here by a ligament so that it can just rotate. Yeah. And this shows you what those little transverse foramen are. There's space for an artery, a vertebral artery that comes up and goes up into your skull. And even if you look at a giraffe, they also have 7 cervical vertebrae. Now, a goose has 20 or 30. They have a long neck, they can preen themselves. But in mammals, a couple exceptions, they all have 7 cervical. It's just in giraffes, they're about a foot long. They're awesome. Yep. So if you look at cervical, you can see it's the smallest. It gets bigger in the thoracic, and then lumbar gets the biggest because it's holding more and more of your weight. All right, thoracic vertebrae. These are in your thorax, and there's 12. You have 12 pairs of ribs. So each thoracic vertebrae gets a rib. And if you look at one of these, you'll see little facets or little smooth areas for the rib. I'll show you how the rib anatomy is, but you can see here on the transverse process, there's a facet. And then on the body, there's a facet. And so you're going to see the rib sits, here's the head of the rib, and then there's a little tubercle of the rib that comes out here. So these are the 2 points of articulation of the ribs on either side. But generally, I can tell a thoracic, it kind of looks like an elephant. You guys see an elephant here where the nose coming down and the ears coming out? How's that look? So the spinous process of thoracic vertebrae points downward sharply. Yep. And we just number them T1, T2, all the way down to T11, T12. Then we usually have 5 lumbar vertebrae, L1 through L5. And you can tell these because they just have huge, chunky bodies. And you can tell the transverse, and spinous processes are massive but short. Yeah, can't miss a lumbar vertebrae. They're really big. Yeah. And usually we have 5. Some people have 6. You could have 4, you know. Yeah, we name them L1 through L5. And so, for instance, I had a herniated disc L1, L4, L5. So between those two. All right, your sacrum. The name, there's interesting ideas. Often found in burial sites, maybe sacred. It's a big chunky bone, so it doesn't disintegrate before a lot of other things do. Your teeth last the longest, but sacrum shows up a lot. It's clearly made up of usually about 5 fused vertebrae. And you guys, most of you in class, they're not fused. You've got cartilage between them, but they're really close. And as you get older, they will fuse into one solid bone. And the sacrum, the solid bone, is what's going to connect your pelvis, so thus your lower limbs, onto this axial skeleton. So the sacrum wants to be solid. And it's going to articulate here with your pelvis, the ilium. We call it the sacroiliac joint, moves a little bit. And the surface is called the auricular surface, like auricle, kind of ear-shaped. It's rough so that your pelvis fits in there nicely. You can see there's the vertebral canal is a sacral canal, comes through here. There'll be nerves coming out of all these holes and blood vessels. Yeah. So this is your sacrum. And then your coccyx is your little tailbone there. Yeah. So your coccyx, it's going to be 3 or 4 or 5 little fused vertebrae that make up your tail. If you look at a cat or something like that, or a dog, it's got a dozen, 20, 25 caudal vertebrae, tail vertebrae. Now in us, we start out with a bunch of tail vertebrae, but they get reabsorbed and we're left with just a few. And so we don't have an external tail. We just have this little coccyx, which doesn't actually fuse until like your 30s usually. So this usually, and then as an elderly, the coccyx tends to just fuse to the sacrum. When you're younger, there's a little bit of spring. If you sit down, it gives a little bit. But if you fall on your butt, or you're skating or something like that, you can break it, of course. It's very painful. You'll sit on this pillow, I guess, to help alleviate sitting on the coccyx. So our tailbone, the coccyx, has no real function to us. There's ligaments that attach to it. Some pelvic muscles will attach to it, but just a rudimentary tail that we have, this little coccyx. All right, well, lots of problems with the spine. I talked about the lumbar region. Most of humanity suffers from lumbar pain. But we walk upright. We can see pretty far. We can carry groceries. Well, what can happen to the discs? You guys know all kinds of disc issues. I showed you a picture of my MRI. I had a herniated disc here in L4, L5. And if it herniates into the spinal canal, no bueno. It's going to be pushing on nerves, your spinal cord, and cause pain and lack of function if you just let it go. So the disc can bulge and eventually herniates. As you get older, that fibrocartilage dehydrates, and you can imagine an injury, or just with age, that outer part dehydrates and cracks so that the inner part leaks out. And so discs will thin, you'll lose that gooey center, and if debris goes into the spinal canal, it's going to cause nerve problems. Osteophytes are little bony formations. I can see a bunch of those on my MRI too when I looked at my back, but you have a little growth of bone, which is not going to cause a problem unless it's going into these canals. And we're going to know the name of these canals. You see right here, these holes. When you put vertebrae together, they make these holes. They're called intervertebral foramina. Intervertebral foramina over there. That are these holes here that are formed between the vertebrae. Yeah, and that's where the spinal nerves come out. So I'm talking about osteophytes. If you have bones forming, the bone is growing in there, it'll pinch those nerves and cause major issues. All right, you guys, take a look at the spine. I'm going to ask you one particular vertebrae. Say, which one is this? You say that one's like T6 or 7. I'd have to count. This is T1, 2, 3, 4, 5, 6, 7, 8, T8 actually. So, and I say, what's this one? I know it's L4 because you know this is L5, right? What's this one? I count it from the top, it's going to be C6. So that's how we name them. C1 through 7, T1 through 12, L1 through L5, and then the sacral and coccyx. And you add them up, there's about 26 bones there. If you count the sacrum and coccyx as one. What do you guys think? Look at the shape of it. See how the bodies get bigger and bigger as you go down? So the biggest body is L5. And C1 doesn't have a body, right? The atlas. How you guys doing? Talking to computers is weird. I get no feedback. Yeah. And there's curvatures, cervical, thoracic, lumbar, sacral. See, they alternate convex and concave. And which two are the primary curvatures? Because we start out like a fetal position. Then we gain the cervical and lumbar. All right, so we'll talk about some ribs here and sternum. So your ribs, your thoracic cage. My first lab we did talked about, we compared the cranial cavity with the thoracic cage, and a little less protection, but your ribs are nice protection for your delicate heart and lungs, right? But it allows flexibility. It's going to be 24 ribs, 12 right, 12 left, in this cage. And it's all kind of a pointed down cage. So we breathe in, it kind of tilts up, our chest gets bigger, and comes down, our chest gets less, right? And we're talking here about our ribs. And the front, we call it the sternum, or your breastbone. It's going to be in 3 parts. And your ribs are bone, and they attach via cartilage, some hyaline cartilage. We call those costal cartilages. Anything rib is costal. So the muscles are intercostal muscles. There's an intercostal nerve artery vein, and costal cartilages will be connect the bone to your sternum. And then our upper limbs are only attached by our clavicles, our collarbones here onto our sternum. Yeah, and so it protects and also has a role in breathing, because you can move your chest, it gets bigger and smaller. It's going to help move air in and out. Also, the muscles are delicious with barbecue sauce. All right, so our ribs, so you have rib 1 through 12 right, 1 through 12 left. So we have 24 total ribs, 12 pairs, right? And we named the first 7 true ribs because they attach by their own cartilage to that sternum. Floating ribs are the last 2 that don't attach to the front at all. They're just kind of back there. They have some protection. And then false ribs, the first 7 are true, the next 5 are false because they don't have their own connection. I'm not a fan of that terminology, true and false. They're not false, they're all ribs, all right? But true ribs we call if they have their own cartilage connection. So looking at the ribs, yeah, your first rib's higher than you think. Here's your clavicle, and the first rib's above that. So yeah, quite a high. And then you'll feel, we'll talk about that, a little notch. Then we'll be able to feel these ribs. And we want to know what ribs they are when we do the heart, cardiology, to know where to listen for heart sounds, where to put ECGs. So the intercostal space will be between which ribs we're talking about. So we'll get some landmarks to figure out where your ribs are, so we know what we're talking about. And you can have, I've seen cadavers that have forked ribs or that have extra ribs. You have cervical ribs, lumbar ribs. You can have actually, 24 is the average, but people can have 25, 26, 24. Oh, 24 is normal, 23. And I look at the anatomy of a rib. You've got a head, a neck, and the shaft, or body, they call it here. And then you got a tubercle, a little bump right there. Take another look at it. So the articulation is interesting. These are joints. They're real synovial joints with fluid in there and everything. So if you hurt a rib joint, that sucks because, if your elbow joint is screwed up, you can just wear a cast, right? But you can't stop breathing. So you feel, apparently it's very painful to have a dislocated rib because with each breath, you're going to have that pain. And I want you to know how they articulate. So each of the 12 pairs of ribs articulates with a thoracic vertebrae in 2 spots. The head is going to articulate on the body, actually kind of between 2 vertebrae. There's a little, like a half facet, because it goes right kind of in the middle. And then that tubercle is going to articulate on that facet on the transverse process. So each rib articulates in two spots on the vertebrae. The head is right on the body, and then the tubercle is on the transverse process. And these are joints that are movable, just like a knee or an elbow or wrist. All right, you got it? Yeah, and the underside is a sharper edge. It kind of protects a nerve artery vein that runs between each rib. Oh, another view. Gorgeous, huh? You guys see this? Look at that. So see what I was talking about? That head, it kind of goes in between two vertebrae, right? So each thoracic vertebrae has a hemifacet, that's sometimes called, or half facet. See that half? Maybe half over here, half over here. And that's where the head's going to articulate. And then as you come up the curve, there's going to be a tubercle. That tubercle will go on a facet on a transverse process. See that? A facet. Yeah. And you can see the ribs kind of pointed downwards, but if you take a big inhalation, they move up and they fall back down. What do you guys think? So you know that's T1, it's got a rib, you know the last one's going to be T12. All right, now your breastbone. The breastbone, or sternum, has three parts. The top's called the manubrium, means the handle, like you hold a sword, and the body, and this is the xiphoid process, that little pointy thing down there. So you do CPR to find that xiphoid process and then put your hand above it to do compressions. And that xiphoid process, some people it sticks out or in. I've seen chests that have like a little dimple there or a little thing sticking out. So it's interesting. And that xiphoid process, God, that doesn't even ossify till I think you're like your 30s or 40s. It's crazy. And then just like the coccyx, your whole sternum will be all kind of one, but you guys, it's still flexible. There's cartilage between it. All right, well, let's get back to here. So on the manubrium up here, interesting, huh? It has the clavicles will come in. So I mean, there's a little notch here, a little notch on top. That's the top of my manubrium. Then I feel my clavicles come in. There's a joint there, sternoclavicular joint. Yeah. And then as you come down, you'll feel a line here. Yeah, it kind of changes direction. So between the manubrium and the body, it changes direction. Call it a sternal angle. You guys all have different sternal angles. This looks a little different on everybody. And then I feel the body, and then I feel my xiphoid process, the pointy thing that's at the very bottom. Yeah, what do you guys think? You can see the ribs. I can see your rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, rib 7. And notice the next ribs don't have their own connection. They share that sucker there, right? So the first 7 are going to be down to here, are going to be true ribs, 1 through 7. They're going to have their own direct connection. Everything below that, the last 5, don't have their own connections. They're called false. Last slide. All right, just showing some whale vertebrae. I'm holding a small one. This is up in Bar Harbor at the, there's a museum there. I'm forgetting the name right now. I'm sure a lot of you have been there. All right, so we talked about the fontanelles, or soft spots in the baby's head, and then talked about the vertebrae, ribs, and sternum. So we've completed our axial skeleton. And what's left is your appendicular skeleton. It's like an appendix in a book. It's like an add-on. So this will be, we'll talk about your clavicle, your scapula, and your arm and hands. We'll talk about your pelvis and your legs and feet. So those are the bones that are left. Yeah, those are straightforward. I have a lot of interest to you guys, I know. Even me, like lecturing on this, I'd much rather have you in lab. We'll have the bones in front of you, the skeleton in front of you. So, but we got to do our learning outside of lab, and then when you get in there, just utilize that time, and I'll test the hell out of you guys, and hopefully you guys will do your work now, learning these parts of the skeleton, and then when you're in person, you'll be able to see these. And our practical will be, you'll be looking at real bones. All right, we are done.